Hello and welcome to another emergency Q&A for families in intensive care and intensive care at home. I'm your host and my name is Patrick Hutzel from intensivecareathome.com and intensivecarehotline.com. I am here to answer your questions that you have about intensive care or intensive care at home. I'm doing these YouTube lives every week, once a week, usually around this time, 10:30 a.m. on a Sunday, Sydney, Melbourne time, and which is 8:30 p.m. on a Saturday evening, US Eastern Standard Time, 5:30 p.m. Pacific Time, and I believe it is 1:30 a.m. in the UK at the moment. Now, I also want to welcome you if you're watching this on replay. Feel free to comment. If you are live here, I want to thank you for your support. Please type your questions into the chat pad, or you can join me live on the show here by clicking on the StreamYard link that I just posted in there. Now, what makes me qualified to answer questions for families in intensive care? I have been working in critical care for nearly 25 years in 3 different countries as a critical care nurse. I've also worked as a nurse manager for over 5 years in ICU, and I've been consulting and advocating for families in intensive care since 2013 at intensivecarehotline.com. I'm also the managing director of Intensive Care at Home, where we send our critical care nurses into the home with Intensive Care at Home. We've been operating since 2012. With Intensive Care at Home, we're currently operating all around Australia, in all major capital cities, as well as regional and rural areas. You might hear a beep in the background. I also need to say that you might hear a beep in the background. I've got an appliance that I can't switch off and it keeps beeping. So I do apologize if you hear a beep in the background. With Intensive Care at Home, we are also NDIS, an NDIS approved service provider, TAC approved service provider in Victoria, WorkSafe, NIISQ in Queensland, as well as iCare in New South Wales. We also provide level 2 and level 3 NDI support coordination. Now, normally I go for an hour on these YouTube lives. Today I need to shorten it to 30 minutes only. So if you have questions, please type them into the chat pad or join me live on the StreamYard link here, because I have put that StreamYard link in there and you can join me live on the show and ask me questions directly on or off camera. It doesn't matter to me, but your questions are more than welcome. If you don't have any questions right now, then I will read out the questions that have come in during the week. And I will start with some questions that have come in during the week via email. And here is one question from Anna, who says, "Hi Patrick, my sister-in-law has been in ICU since the beginning of January. She had open heart surgery. She has many health issues, heart failure, her kidneys only work 10%, so she's on dialysis. She has been ventilated from the beginning of January in the last 6 weeks with a tracheostomy tube. But unfortunately, all tries of weaning her off mechanical ventilation failed every single time. She ends up with carbon dioxide poisoning. Her mental state is really compromised. Why can't she be weaned off the ventilator?" That is a great question, Anna. So it sounds like something must have gone wrong during open heart surgery. Maybe it was unplanned. Maybe she had a cardiac arrest, a heart attack. Maybe she needed a valve repair, valve replacement. Maybe something went wrong during cardiac surgery, which is why she ended up in ICU long term. That might be one thing that has happened here. Obviously, you didn't give too many details on why she has stayed in ICU for so long. So she's now had a tracheostomy tube for 6 weeks, but unfortunately, all tries of weaning her off mechanical ventilation failed, as every single time she ends up with carbon dioxide poisoning. So what's probably happening here is, for whatever reason, when they're trying to wean her off, her carbon dioxide or her CO2 keeps rising, and then she gets back on the ventilator, right? And if carbon dioxide is rising, her mental state might be compromised because patients might get foggy, for lack of a better term. Their brain they might end up with brain fog because of high carbon dioxide. But maybe there are other mental health issues as part of her staying in ICU for at least 6 weeks now. Generally speaking, if someone has been in ICU for 1 week or more, they're technically considered a long-term patient, right? So in her case, she had a tracheostomy tube 6 weeks ago, but she would have been in ICU prior to that. I argue at least another 2 weeks prior to that. So she would be in ICU for 8 weeks. So she would most likely be clinically depressed just simply by being in ICU for so long, and the inability to wean off the ventilator would cause further stress on her, right? And she would have no quality of life in there. And what I've seen, in all my time working in ICU, patients are stuck in a vicious cycle. So what I mean by that is they're stuck in a vicious cycle because they can't wean off of the ventilator. They're making progress. Then it's often 2 steps forward, 1 step back, right? And that's why they're stuck in that negative cycle and also in that negative environment. Now, one thing that helps here is definitely physical therapy, definitely mobilization, definitely, playing your sister's favorite music, having pictures in the room that show her family, people she loves, maybe pictures of things she really enjoys, that is really important. However, the best option from my experience in a situation like this is to take her home, right? And continuing the weaning at home, because it's just a much more conducive environment at home, right? And that is why, she's stuck in that vicious cycle. So I would definitely consider home care in a situation like that. And, if you're watching this and you're stuck in a similar situation, I would encourage you to check out intensive care at home at intensivecareathome.com for more information. But, like I said in the beginning, we are providing intensive care home services. And the best option for Anna here for Anna's sister would be to go home, I believe, especially since weaning has failed and you're saying her mental state is really compromised. And most patients that are stuck in ICU on long-term ventilation, their mental state is compromised because they're clinically depressed. They're often deconditioned from the ICU stay. And it's a terrible situation to be in for all parties involved, whether it's for the patient, for the family, but also it's also negative for intensive care teams at times because the bed is occupied, they don't see a lot of progress. Whereas for your sister going home, it would probably include making progress, and even if it's only on a mental level. Now, other things that I don't know is, why is she not making progress with the ventilator? Is there some lung scarring? We would need to look at CT scans, MRI scans, chest x-rays, arterial blood gases, and so forth. But, I can't stress enough that going home would be the best option. How does going home work? Well, first off, your sister needs to be hemodynamically stable, which I believe she is. You haven't shared anything. You're making it out that if the long-term ventilation seems to be the main issue, and by her going home, she obviously needs a team of critical care nurses 24 hours a day. She also needs some medical oversight. She also needs some funding, right? And by that, I mean, someone needs to pay for it, Currently, your sister's ICU bed would cost $5,000 to $6,000 per bed day, right? Intensive care at home approximately costs half of that, approximately costs 50% of that, right? And in that aspect, it's a win-win situation, right? So here in Australia, for example, with NDIS funding, again, the cost can be minimized to 50% of the cost of an intensive care bed. We would organize the equipment and we would assemble a team of highly skilled critical care nurses to continue the care of your sister at home. Look, she might also have private health insurance. She might have another insurance scheme. It's not clear from your email, but I hope that gives you some clarity around what needs to be done to wean your sister off the ventilator? And if she can't be weaned, what is the next step? You know, how can the situation be improved? How can she improve her quality of life? And the bottom line is the quality of life can be improved by going home, because at the moment she's stuck in a vicious cycle, right? So I hope that answers your question, Anna. For anyone watching, please type your questions into the chat pad. If you have any questions, any other questions, please type them into the chat pad or join me live here on the show on the StreamYard link. On the StreamYard link that I have posted there, please join me or type your questions into the chat pad. If you don't have any questions, I will continue with other questions that I'm having from Pat, who says, "Hi Patrick, my mom is on the ventilator and she's not responsive to verbal or tactical stimuli when they're doing neurological tests." So the question here is then, Pat, why is she not verbally or, why is she not verbally responding or responding to stimuli such as touching or talking to her? Why is that? Is she simply in an induced coma, or is she having a stroke or a traumatic brain injury or seizures, or did she have a cardiac arrest? What led to this? What led to this? The more information you can give me, and it's for anyone who wants to give information, have their questions answered, the more information, the better. I'm trying to answer all questions here as much as I can, but sometimes I can only give limited answers because the information that you are giving me is very limited, so the more information, the better. So I got to move on from that question because I simply don't have enough information to dig much deeper there. But the bottom line is she in an induced coma? Is that why she's not responding? Or is she in a natural coma from a neurological event such as stroke, traumatic brain injury, and so forth? So, next question. Type your questions into the chat pad or join me live on the StreamYard link here, and you can talk to me directly. Now, also today, I need to shorten it to 30 minutes only because I have something urgent and unexpected to go to. So please type your questions into the chat pad or join me live on the StreamYard link. Now, here is another question from Helene, who says, "Why was my mom continued to be prescribed fentanyl after she was weaned off the ventilator and returned home? Why was fentanyl concealed from me due to its generic name? Why was I not informed that this drug is addictive and there was no way my 84-year-old mom was able to stop taking fentanyl? Unbeknownst to me, she was addicted to it. Why was she not prescribed the antidote for fentanyl?" That is a good question, and that's a question from Helene. And that was a comment from one of the videos on my YouTube channel. So that's a good question. The question is, why was she in pain? Was there anything else that she was having pain for? Is that why she needed the fentanyl, right? And yes, families should absolutely be informed that if they are giving fentanyl for their loved, or that fentanyl is given for their loved one, that it is addictive in nature. That is definitely something that should be made transparent to patients and their families. So then let's move on to the next question. But there should be full transparency one way or another. There should be full transparency one way or another that fentanyl is given, or any other medication for that matter, and it should be made transparent that fentanyl is addictive in nature. Very important that ICUs are transparent. Okay, I have another email from Jane who says, my daughter is in ICU and they have refused to show me the medical records despite me asking for it. Okay, well, that's a concern, Jane. What you should be doing there is, first off, you need to clarify the next of kin or power of attorney status. They can only really refuse the medical records to you if you are not the power of attorney or the next of kin in a situation like that. I've never really seen that family members who are the next of kin or power of attorney are not given the medical records. You know, you might have to fill in a form, right? And sometimes there might be a little bit of a lag time, but the reality is that, you know, they have to show it to you, you know, in any jurisdiction really. And like I said, I haven't really seen families not getting access to the medical records, assuming they are the power of attorney and assuming they are the next of kin, you know. So if you are the next of kin or the power of attorney, soldier on and keep asking for what is your right. This is your right. It's not a privilege. Okay, so then next question from, well, it says here from Moon Girl. Anyway, it says, hi Patrick, does a doctor's negative attitude affect how he is treating my sister? He told her husband that there is a fine line between hope and delusion, and he needs to get in touch with reality. I hope this doesn't affect decisions the doctor is making in regards to her treatment. I am appalled at his horrible bedside manner. She is in an induced coma with a serious TBI. TBI means traumatic brain injury and skull fracture. She has been in an induced coma for 2 weeks. Look, there's probably some research out there, and I couldn't cite it, but there's probably some research out there where, you know, attitude has been considered as a factor in how patients and families are being treated when they are in intensive care. I do believe that a negative attitude is also negatively impacting on how the doctor is treating your sister. You know, I mean, I've worked in ICU for, you know, or in critical care for nearly 25 years. And, you know, you have one doctor having a negative attitude, and then you have the next doctor coming in with a really positive attitude, and it can make all the difference. The same is applicable to doctors, nurses, you know, physiotherapists. It's not unique to doctor. I do believe a positive outlook can make a positive difference. So, you know, for example, I have seen from my own experience when I worked in ICU, you know, I would have seen one consultant saying, oh no, we're not going to do this treatment for this patient because I don't think it'll work. And then you have a change in consultants, you know, often they're on for 7 days off. Then you have the next consultant coming in saying, oh, I think we can do that, you know, and I think we should be doing that, because they have a more positive outlook and they might be more tuned in with what patients and families want, you know. So a lot of it comes down to that. You know, and you are appalled at the horrible bedside manner, you know, maybe you can say something about the bedside manner, you know, and maybe you can even raise a concern or a complaint to, you know, maybe ICU management or to the hospital senior management even, you know. They may want to know that this is happening, you know, and the hospital management might say, well, not under my watch, you know. Just some food for thought here. Okay, other email that I have here is from Preya, who says, hi Patrick, my uncle is not waking up even after his sedation is removed. He was on sedation for 16 days. It has been 5 days since his medically induced coma has been removed, but still he's not waking up. He is a severe post-COVID-19 patient. He had multiple organ injuries and lung damage. He also had a mild cardiac arrest and neurological damage. Your videos give me hope. Please pray that he wakes up. He has a 4-year-old son waiting for him at home. So he was on sedation for 16 days. It's been 5 days since the medically induced coma has been removed. He has severe post-COVID. Okay. So here's what I think might have happened, especially if he had COVID and he had the COVID pneumonia or COVID ARDS. Well, first off, the lungs would have taken a massive hit from that. Number two, in order to keep your uncle alive, they might have proned him. They might have put him in prone position, right? They might have had him even on ECMO, right? And either way, they would have had to sedate him really deeply. He might have needed paralyzing agents to get him into prone position, right? And if he's in prone position with heavily sedated, with heavy opiate use and paralyzing agents, it can take a long time to wake him up. So for example, when you prone someone, putting them on their tummy, head down, so that the lungs can expand, right, and secretions can drain via gravity because it's head down often, right? You need to deeply sedate someone to make that happen, and that unfortunately comes with massive side effects, right? Side effects such as not waking up within normal timelines, comes with side effects such as massive deconditioning, that people have to rehabilitate almost from scratch. They have to almost learn to start to walk again, start to move again, start to eat and drink again, right? So also you're saying he had multiple organ failure and lung damage, and also had a mild cardiac arrest and some neurological damage. So, that's not a great combination for waking up, but time will show you and your family whether he will wake up and, how he will wake up, So I hope that answers your question. And, you should never give up hope prayer in a situation like that. And it sounds like your uncle is quite young, not that you've given an age, but, you need to give it some time, need to pray, but also need to look at the facts. What sedation did he have? What sedatives did he have? And what opiates did he have? Have they used the antidote to potentially waking up? Are they stimulating him? If there is neurological damage, have they given him, are they giving him some form of stimulation, physical therapy? Have they done a CT scan of the brain, MRI scan of the brain? Have they done an EEG of the brain? Have they done a neurological consult? So I hope that helps, prayer, to answer your question. Now, James, you have a question. You say, hi, Patrick, how often or how likely do nasogastric feeding tubes clog up? That's a great question, James. From my experience, they shouldn't clog up at all, assuming you're doing all the right things. So what I mean by that is, often in ICU or even at home, if someone has a nasogastric feeding tube, medications are given via the nasogastric tube and enteral feeds are given via the nasogastric tube. Now, especially when medications are given, you have to crush the tablets and you have to make sure they are crushed very thoroughly, so it's really just fine powder. Then you need to mix it up in water. You need to make sure there are no clogs in the water, right? And then you need to give it via the nasogastric tube, and then you need to flush it really well with water so that there's no powder left in the nasogastric tube, right? Now, some of it also comes down to what nasogastric tube is it? Is it a fine bore nasogastric tube or is it a wide bore nasogastric tube, right? A wide bore is much bigger in diameter, which means it's less likely to clog if you're doing all the right things. A fine bore is fine, it's much smaller in diameter, and it's much more likely to clot, because it's much smaller, right? But generally speaking, it shouldn't clog at all. Some nasogastric tubes can stay in for 3 months. Some I've seen even for 6 months, right? And if you do the right thing, similar to a PEG tube, they shouldn't clog at all, right? Does that answer your question, James? You know, and I would be curious to know why it's clogging. You know, I would be curious to know why it's clogging. You know, and are you potentially at home, or are you going through my dad's medical records? I've learned that dad's NG key was clogged 8 of at least 11 days. Wow. Wow. Oh, I see. So you're going through medical records, right? Right. Shouldn't be clogging at all. And let's just say it does clog and they can't unclog it. They need to change it. Right? They need to change it. Right? So should not be left there sitting clogged and not having an alternative. Right? Not getting an alternative. That's no good. So there was a kink at the nostril entrance, but even if there was, James, it still shouldn't matter. Shouldn't matter. You know, if there was a kink, it should not matter. They should then change it. You know, they should then change it. Right? That's starving 8 out of 11 days in gross negligence. Yeah, most likely. Absolutely. Unless they've given him TPN. TPN is intravenous nutrition. Unless they've done that, that is something you need to find out in the medical records too, whether they've potentially given him TPN. Right? You can, I'm sure you can find out whether they've given him TPN. TPN stands for total parenteral nutrition. Right? For everyone watching this live on the show, I know we've got quite a few viewers, and thank you for all your support. Guys, today I do need to wrap this up in a couple of minutes because I have something unexpected coming up. Normally I go for an hour. I will do another YouTube live next week, same time, 10:30 a.m. Sydney, Melbourne time in Australia, which is 8:30 p.m. Saturday in the US. And Canada in North America, 8:30 p.m. on a Saturday evening, 5:30 p.m. Pacific time in North America. James, if your dad had an IV line, they may not have been able to give him TPN because TPN needs to be given through a central line, a PIG line, or a Hickman's line. So you might again dig a little bit deeper. The devil is in the detail when you have a loved one in ICU like this. Right? So unfortunately, I do need to wrap this up here. If you like my videos and if you like these YouTube lives, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. You can also leave a small donation here on the super chat button to help me and my team make these videos. The more we can help families in intensive care. If you need intensive care at home, go and check out intensivecareathome.com. Like I said, we're currently operating all around Australia in all major capital cities and all regional and rural areas as well. Thank you so much for watching. This is Patrick Hutzel from Intensive Care, hotline.com and intensivecareathome.com, and I will be talking to you in a few days. Take care for now.